So I am Catherine Preventure, Director of Patient Advocacy for the IgG4-RD Foundation. I am also a caregiver to my husband, as most of you know, who lives with IgG4-related disease. And like many of you, I have spent countless hours, days, years learning how to talk about this condition and explain it to my family, to friends, to employers, and even to our children. So that is why we decided that this webinar was very important to have, because I'm sure I'm not the only one. And first, I have brought together a group of individuals that I would like to introduce. Damon Brooks, an individual living with IgG4-RD, and he brings honesty, heart, and wisdom to every conversation. Donna Ship, also living with IgG4-RD, who brings the clarity of a nurse and the compassion of someone who deeply understands what it's like to live with this disease. And Jess Noble, who is a caregiver to her wife, Kim, who lives with IgG4-related disease. And she'll speak to the unique experiences of how to communicate as a caregiver. We're honored, very honored, to have an expert physician, Dr. Masami, who is a respected IgG4-related disease specialist and an advocate for patient-centered care. He will offer clinical insight and communication, wonderful strategies from a provider's perspective, which is so important. So before every webinar, we begin every conversation with our mission statement because it's very important for us. And at IgG4-RD, our mission is to enhance lives through education, awareness, research, and to serve as a trusted source of truth in IgG4-related disease. That mission is why we're hosting webinars like this and why we have so many exciting things ahead this year. Before we begin, I want to highlight just a few announcements for the community. We have some upcoming events to look forward to. Our next fireside chat is very exciting for us. It is June 6th, and it's going to be a fireside chat regarding treatment. And as you can see in the title, it says a community discussion. And the reason why is this is our first fireside chat that we are opening up to the community to have questions live during the fireside chat. So in the past, we've asked for you all to submit your questions, and we have tried to answer them the best we can. But this fireside chat, we will have experts, about 2 or 3 doctors on, as well as some wonderful videos between some experts in the field discussing treatment. And then we will ask you to please, if you have questions regarding that fireside chat, we will open it up there. Our next fireside chat after that will be July 11th, and that's going to be regarding retroperitoneal fibrosis. Now, this is an area that we are seeing so many of you involved in. And so we really want to educate the community about this part of IgG4-related disease. And then in August, we have asked Dr. Camille Cotton to come back. So on August 8th, we are going to be having another great conversation right before the fall hits and everybody goes back to school and those germs all come back with a vengeance. We are going to talk about vaccinology for people living with IgG4-related disease and what we need to know. So we have some information that we need to share. And as you can see, the announcement that we shared last week regarding the Peach Jam has a line through the dates. We have had to change the dates. Don't worry, we are going to do it just the week before at September 12th and 13th. Same location, Atlanta, Georgia, Emory Conference Center. We apologize for this inconvenience, and we really try to get this nailed down and straightened out in time for anybody that may be having to take off work or, has already booked travel. Hopefully this is enough time for you to make changes if you've already done that. So please, please, please join us at the Peach Jam. I am so excited to be down in Atlanta. It's a special place for me, and to be at Emory with all of you. Look forward to it. We're going to begin with our special presentation of the video. Let's begin.
I'd start by saying this is rare, and it's an autoimmune disease that causes inflammation. In my particular case, it just causes your body to attack itself. I try to keep it break it down in layman terms. In the basic way, I just say it causes your body to attack itself. And in my situation, my body, my cells attacked my central organs. And that's how I try to explain it to them. And if I'm talking to somebody maybe in the medical field, I might, try to go a little bit more in detail. But at the beginning, I didn't know a lot about myself. I just knew it was a autoimmune disorder and it caused inflammation. And so I kept it simple at the beginning because I was still learning about the disease myself.
I think when I first was diagnosed with IgG4, explaining it to my family was pretty basic because I still didn't have a true understanding of what it was and how in depth it was. So I just kind of, I guess, glazed over a little bit, and I said I have this. I said I have this rare autoimmune disorder. And for me, my body makes scar tissue in my abdomen that for no apparent reason. And that scar tissue just kind of gets tangled up in, like vessels and it's right now it's wrapped around my ureter. So I kept it like very basic and very
And
just.
at the time of Kim's diagnosis, we really didn't have a lot of answers or information as far as what was available to us on the web. So it was really hard to attempt to explain to anyone why a perfectly healthy 35-year-old all of a sudden was so sick, even though she looks healthy and she seems healthy. This is something that's continuously heartbreaking for me to have to explain to people, but it's getting easier. Not being able to kind of truly find the answers to what's been happening or what was happening at the time was really frustrating, and it provided a great source of stress for me as the caregiver because I wanted to be able to provide that information to all of the people who loved her. So it was, yeah, it was extremely stressful, and there was a lot of pressure that came with it, and it's thankfully gotten a little easier.
Some people I would just keep it really short because it's kind of exhausting. You can get exhausted trying to explain, and then you can see people they want to know, but then you can see them losing like not losing interest, but like this like glaze going that comes over their eyes, like, and then so you just know like oh you just kind of cut it short, just to know who you're talking to.
And so but it really presents a lot of challenges for people like me who come to the emergency room with huge stories, with long stories that aren't easy to tell, that aren't going to take that don't take 5 seconds, and it isn't something that is known so well by the medical community that all you have to say is I have IgG4 and they completely get it. They're like, okay, now I know and so they are there to treat the emergency and move you on to the next level of care that you need, whether it's treat it and like discharge you because you're good now, or treat it and move you on to a higher level of care that's going to do that. So the ER is not the place that you're going to find the ability to do this deep dive into stuff. It's kind of like you really need to do, you know, the quick hits with, look, this is what I have, this is what's going on, this is a flare, or this is whatever my symptoms are, and I need you to acknowledge that, treat me for the emergency, and move me on to the level of care that I'm going to need, where I can now unpack this whole thing for somebody and they have time to go through the chart and continue with treatment or find something else or consult with my, or consult with my rheumatologist or whatever, because that's not going to happen in the emergency room.
Not being able to kind of truly find the answers to what's been happening or what was happening at the time was really frustrating, and it provided a great source of stress for me as the caregiver because I wanted to be able to provide that information to all of the people who loved her. So it was, yeah, it was extremely stressful, and there was a lot of pressure that came with it, and a lot of what's happening. And because we went through a misdiagnosis process, as do so many IgG4 related patients, it was really frustrating. And so when we finally got the diagnosis, it felt like a weight was lifted. Unfortunately, that didn't last very long because the information that was available to us to explain the disease and the diagnosis was not really relevant, especially for Kim, because all of the history that we could find was really on middle-aged or older males at the time. So because it's so rare, it made it really hard. And it did feel like there was a lot of pressure to have the answers. And thankfully, it's like I said, it's kind of just become easier as we've continued to learn more about the disease and how it affects our daily life.
First,
Totally.
encourage them to try to read up and learn as much as they can about the disorder, and then explain it the best that they could. But also sometimes it's just best to just start by saying, this is how it makes me feel. This is how it makes me feel before you start going into the technical terms, or getting technical with it. But disease makes me feel, it makes me feel like this, and it depends on what organs it may be impacting, what part of your body it may be impacting, then you go into that. But just keep it kind of basic at first, like it's a disorder that causes inflammation and it causes your body to attack itself.
Explain it.
And you can go.
You don't have to explain it like you're teaching a course on it to every person, They just
Yeah.
want to know, what does it look like for you? They don't need to know, the whole thing. If they want to, they can look it up. And if they're like, hey, where would I get more information? You can certainly point them in the right direction. How do you understand your disease? What does it mean to you? And what does it look like for you? And then just explain to people, this is what it does for me, but it can look very different for other people, depending on what their manifestation is.
When Kim was first sick, she had a bowel obstruction. And so we didn't know IgG4 was going on, but she ended up having an emergency surgery, which was obviously going to put her out of work. And so I had the great pleasure of talking to her awesome manager and their HR team and getting all of her paperwork going. So we got her short-term disability started, got her medical leave started. And then I was able to communicate with them throughout her recovery process just to keep them updated and in the loop so that they didn't feel like they were bothering Kim too much until she started to recover a little bit more. And so continually trying to tell people like, hey, we want to be invited. We want to be there. We love that you invited us and you think of us. I'm so sorry we can't make it. Kim's in a lot of pain, or she's not feeling well, or she's nauseous, or us as a couple just aren't in a space to go out right now because I'm exhausted as the caregiver. Like it's really hard to try to get people to understand, I think, and really grasp the gravity of what we mean when we say those words. Because unless you live it, like it's hard to understand the life of a caregiver in any situation, I think, or a patient for that matter. It's something I'm really trying to find ways that I can mitigate this so I don't have to repeat myself so many times, but also can inform people and like get word out about like, hey, if you want to learn more about this, like, here you go,
Our disease, you may not physically see how it may be impacting us, and that's scary. Sometimes people are like, what's wrong with you? And it's like, you had to ask. I'm not today. I may not feel like explaining it to you, but sometimes that's something you have to stop and educate people. But we're human too, and sometimes we get exhausted, we get tired, and so we have to know. Like today, I just don't feel like having that conversation, or today, let me just kind of explain to you what's going on, so in the future, if you're around me, you see I may not be my normal self, you'll know what it is.
And I have noticed this lately. I look back and I'm like, boy, in the past year, I really haven't done too much outside of my own like everyday life. I haven't gone on vacation, and I used to go like a couple times a year, and I haven't really gone on vacation. I haven't gone anywhere, and I really haven't been motivated to because I'm tired, and it's like I notice it myself. I don't know that other people would necessarily notice it, like, oh my God, you're not booking vacations all the time, but I notice it myself. Like I don't travel too much anywhere. I don't really go out too much. I'm not somebody who will be like, oh my God, let's go shopping all day. Like where I could go before and be like, oh my God, okay, I'm going to go to the mall. I got all these errands to do. Now I find myself like, if I have to go out, like I have to go, I'll go to the mall. I'll do this one thing. And then I turn around and go home because I'm tired.
I live with Kim every day. We're never apart except for when she's at work. So it's like I see it and no one else can see it. So being told I was doing a good job, like by my parents and by Kim's parents, yeah, this will make me emotional. It takes me back to being in the hospital with her and making those phone calls, and trying to explain what was going on when we didn't know. Um, so really being able to have people in our lives just support me and tell me that made the biggest difference in helping me stay afloat when I felt like everything was falling apart. And
We just heard some incredibly honest reflections about how emotionally complex it is to navigate IgG4 related disease. Not only for the person living with the disease, but for the caregivers and their loved ones as well. It is, and I can say this personally, not just as the director of patient advocacy, but as a caregiver, these conversations are hard. And like I said in the beginning, that is why we thought this was so important to have, because I want you all to know you're not alone in this, and you're not alone in having these difficult conversations, and you're not alone in feeling the impact that this disease is having on your daily life, no matter if it's in the beginning of the journey or you're 10 years in. I feel sometimes people feel like they should know it by then. No, it's not that easy. It's such a complex condition that you can't just wake up one day and have all the words, have all the answers. I hope someday it gets that easy, and that's another reason why we are here, to continue to educate so that you can, like Donna and Damon and Jess have all said, then be able to go out and educate your family, your friends, your employers, and make it a little bit easier for everybody involved. So we're going to continue to hear the rest of what Damon, Donna, and Jess have to say. And then we are going to hear a little bit from Dr. Misami.
For individuals who just are recently diagnosed, find someone that you can talk to about it, because it will make you feel better. Someone who you can explain a basic knowledge, and that someone knows what's going on with you at all times. There's someone out there, and if they need someone, we have a foundation, and there's a group of individuals like myself. We're here, and we can help you, guide you through that. But you're not alone. And now with just so many great resources out there compared to even just like a year ago. And so you just need help getting those resources. Reach out and get those resources.
I think one of the natural things that we do when you're first diagnosed with something, no matter what it is you look for your community, right? You look, you go online, you search for the data, the information, the who knows what, and then you look for your support groups, right? Like, where is there a community out there of other people that are like me, that have this disease, this disorder, whatever it is, that I can talk to, that I can, ask questions of other people with this to see, like, is it me, or is this part of the disease, or whatever. And so finding those support groups, how things evolved, and how lucky I was to be involved in certain things that led me to the IgG forward community, and to be involved and have the opportunity to meet other people in person like me, with my disease, and be like, oh my God, that happens for you too. Because
find community and set boundaries. I think one of the most difficult things that we faced early on in this journey was the isolation that we felt, because we didn't have the community of IgG forward, and we didn't know there wasn't much out there that we could access at the time. I didn't feel a sense of peace till Kim sent me her first picture from the IgG forward jam. I think I will never forget the feeling that I got, just seeing that picture pop up on my phone, because I wasn't able to be there, and the smile on her face, knowing that she was able to physically talk to and touch other IgG4 patients that were going through things that she was going through. That was probably one of the biggest weights that I could have been lifted off of not only my shoulders, but her shoulders and our relationship. Just because I can only be so much for her, and I can't be a patient. I can validate her feelings as much as possible and her experience, but I will never be able to say I understand where you're coming from. So it was essential to like find that community. And now we're more continually getting more involved in it, and it's extremely helpful.
Earlier is
And then the other thing was the
patient being
boundaries.
misunderstood or not believed. Again, the disease, IgG4-related disease, has a very broad spectrum of symptoms. It can involve multiple organs. And this patient has been bounced around from specialist to specialist, went through multiple tests, even sometimes went through unnecessary procedures with permanent damage all of a sudden. It can happen. I've seen a lot of cases like that. So one problem is like we are now in the situation that even patient was told this is in your head. It might not be real. So there's a lack of trust. So that main challenge, and we have to tackle that immediately. We have to make sure that we try to build that part. That's a major challenge we are faced with. The second part, actually, I believe is IgG4-related disease, again, involving multiple organs, might all of a sudden have very fragmented care. Patient can be seen by gastroenterologist, rheumatologist, the pulmonologist, ENT, you name it. And it needs one familiar physician or one individual to just connect the dots, to just tie these pieces of puzzle together and just see, well, all of these maybe or unfortunate symptoms could be due to just one underlying problem. So it's another challenge. It's very tough, especially when the disease has such a heterogeneous presentation or maybe multiple organ involvement and being relatively new in medical field. So that's another major challenge we have. Another very important challenge that I face with myself, and I see sometimes my fellows talk to the patients, is the complex language we use. When it comes to complex disease and rare conditions, sometimes as provider, we have to be careful. If we need even to use those language, we have to make sure that we pause, slow down, explain that what they are and why this is important to discuss that. And I'm not talking about even major medical journal. We got to think about that. This condition is considered fibroinflammatory. What is the meaning of fibrosis and inflammation? Why is this even important to be worried about fibrosis? Have you ever sat down with the patient and explained in simple language that if this disease goes undertreated, your tissue will change to what we call fibrosis, which would be not functional or as functional as they should be? We should sit down, and I'm not even saying that what level of education or something, as simple as possible, to the point that patient can relay with us. Even sometimes when my patients, I do have patients who are physicians even, I still keep it very simple because actually physicians or people in healthcare might even want to save face and pretend they understand. Actually, it's the opposite. They might not understand at all, but they don't want to ask questions. So again, these are the three main things I believe would be major challenges. Just to recap again, patients are misunderstood and not believed. So that's something that we have major challenge. We have fragmented care and then complex language. But first off, I always tell my patient, you are your own advocate and you are the ambassador for this condition. These are the two things I believe each patient with IgG4 need to know. We really rely on them. So the first thing is, we will talk about emergency department later. I want to just focus on specialist or primary care physician. When you knock on the door and you sit down, ask your doctor. I mean, it's your right to ask for second opinion if you feel like that's necessary. And how to respectfully ask a physician, because something is uncomfortable, is ask your doctor, have you ever treated a patient with IgG4 related disease? And if they said no, you can just say, well, can you just do me a favor and make a referral to individual who has done that before? It's a way to do that. And I believe that actually will help a lot. And our patients know already about this condition a lot of times when they get to some specialists. Hopefully, this is our hope. The second thing is, it's always important, especially if the patient has known diagnosis and going to ED or different offices, to maybe have some printed materials, some published paper, maybe even ACR ULR criteria with you, a link maybe to IgG4-RD for physicians, or a link to a lecture or a presentation. So share that with your doctor. It's okay. We don't expect the patient to educate physicians, but you are the ambassadors too. So if you share your knowledge, share the resources. I have had this situation. Patient came in, few papers were kind of printed, And some of those papers very interesting because I was either involved or my mentor, like Dr. Stone, was involved. And I kind of I told the patient, I love seeing that because that shows how invested you are in your care, and that helps me to kind of work with you. So that's fine completely to even share this with your doctor. The third thing I always tell my patient that keep actually a health journal. When, what tests, what treatment, what was the outcome? This, even though it might be, you might not think it's important, it actually gives a great snapshot to even physicians who are experienced or not experienced with IgG4 to look at the picture and say, that should be something connected because it seems that there is a team, there is some sort of relationship between all those. So have it with you. Even if you go to ED, this is me, so they can actually help you. And of course, last but not least, other than the visits, of course, patients needs to also lean into community. The online resources foundation, IgG4-RD, not only that, they provide them with some emotional resources and support, which is important, by the way, so they don't feel they're alone. There are many people like them suffering from this condition, but also some practical tips happen there. So patients share. I saw this doctor who was familiar. I did this test that was very helpful. I did this treatment. So again, it's a community. I every single month I join the IgG4-RD fire chat and meeting because I learn. Even though I've done that for the last 12 years, I still learn when I go to those. I mean, I hear the patient concern when I read the questions. So that should be both ways. Patient also need to do that and try to actually spread the word for this condition. Yourself. Number one, don't be afraid of asking questions. Don't follow. It's very completely acceptable that, hey, doctor, can you please walk me through this again and again? So we are here for you, and you can make sure that all of your questions, all of the concerns or things are not clear being answered in that visit. This is your time with the doctor. The second thing, again, being your advocate for yourself, is take someone with you in the office visits. Another pair of ears helps. A family member, a friend who can take notes, who can ask questions, or at minimum, they can be a good emotional support in the office. Also, prepare a list of questions when you go see the doctors. Make sure the questions are all written. That actually helps to have a focus visit with the doctor and making sure that this is informative enough for the patient. And of course, last but not least is I always tell my patient, do you have any question? And they say no. So, well, don't you want me to give you a summary of what happened and what's going to happen next? And they all kind of, smile and say, yeah, actually, that's a great idea. Ask your physician, give me a summary. What happens and what should I expect next? What would happen between today and the next kind of diagnostic test or therapeutic? So ask those, be your own advocate. So as you know, the best way of building a good collaborative relationship is based on really trust, mutual respect, and more importantly, shared goals, open communication. So it's important that provider and patient and caregiver, they come to this conclusion, we are in it together with the main goal as our patient health as a major priority. If we actually agreed upon this one thing first, I think that's the first biggest step. Maybe 50% of the kind of work is done. This is our goal. We have a shared goal. For provider, of course, I want to encourage the provider to ask the patient to be open about their priorities. To ask the patient, what is your priority? Some patient, they want to minimize the side effects of medication. Some patient, they want quality of life. Some patient, they want actually to be able to travel, because these priorities are important for us as a provider to actually have the best decision in terms of treatment, what to do next, and what's best for this patient that's tailored for this individual patient. For patient, at the same time, we want to make sure they're honest with their provider. If they believe a medication is not working, they should be open about that. If they believe the medication is working, also, they should be open about that. If they don't think the treatment is sustainable for various reasons, instead of not taking it, just share that. We're going to talk about that together. We don't want the patient go home and say, no, I'm not going to do it. So then open up in front of the provider, because that's a relationship we're going to build, that we should be close to that part. And last but not least is really, at the end of the day, again, I'm going to go back to respect. If the patient feels they're heard, and if the provider feels they're trusted, that will result in already a collaborative relationship, which will be rewarding for for all the parties involved in that, provider, caregiver, and patient. So that's a very healthy environment to actually take care of patient with such a rare condition, which I believe it's not that rare. I would just say most underdiagnosed condition. And hopefully we're going to learn more about this condition in the future. Caregiver, it is a fascinating condition. We have now new treatment for it. We are learning about it like day by day. And I'm so glad I've been involved in that for past like 12, 13 years. And trust me, it was very difficult at the beginning even to talk to my colleagues about this condition because they wouldn't believe me. Insurance company would dismiss me. It's a very interesting time. I mean, I'm enjoying it and I see that movement. And again, thank you. Thanks to the foundation for kind of doing such a great job. And thank you for inviting me.
Yes. What a wonderful conversation, and how lucky I was to have that conversation with Dr. Misami. Thank you so much again, Doctor, for participating in that interview. He truly taught us, my husband and I, some more things that we could take to the doctor. My husband actually, we have a son with chronic illness as well. And he actually, thanks to Dr. Masami, asked the doctor today if he could provide a summary. And they went over the summary of the visit together. And that was really helpful for my husband to then come back and give me the information regarding the appointment. So thank you so much for your wonderful insights. You really have a thoughtful way of grounding us and discussing what really matters. And, that patient, caregiver, and physician partnership is the most important thing. And thank you so much for highlighting that so well. So there's my family. And before we wrap up, there's a reason why I share this picture of my family. I wanted to take a few moments here to share my own experience as a caregiver, and one that's close to my heart. And this may be familiar to many of you, and it's how do we talk to children? As many of you know, I'm not only the director of patient advocacy, but I'm also a caregiver and a mom. This, like I said, is our family a few years ago. My boys have definitely grown since this picture. My preteen probably wouldn't like it that I'm sharing a picture of him. But I thought it was important to show also that this is the age they were when my husband was diagnosed, when we began this journey. And this is when the uncertainty began. It was around this time that the questions started, and the quiet moments when I could see the worry in their eyes, even when they didn't have the words yet. My youngest there in his little costume, he definitely didn't have the words yet. And professionally, I've spent 2 decades as a clinical social worker, and much of my time working with children just like my own, working with their families, having countless conversations about difficult topics, illness, uncertainties, many different things. So I thought I would be able to handle this and be able to do it. But I want to be honest. When it comes to your own family, it's different. It's very different. And even with all of my experience explaining IgG4-RD to our boys in a way that felt age appropriate, it felt truthful and reassuring, has been one of the hardest things that I've done throughout this journey. I used every tool that I knew of. I had the books, I had the drawings, I used the analogies, and I still found myself stumbling sometimes, when the hard questions like, is dad going to die, would come. But, when it's personal, it's emotional. And when it's chronic, it's ongoing. So it's not as easy sometimes to have these conversations, even when you think you're an expert in it. But here's what I have learned. Kids are very, very intuitive, and they notice when something's wrong. Even if we're doing our best job to protect them from it, they notice. So while they don't need all the details, they do need honesty. And that's where I think I've done my best. They need to hear that their parent or their loved one is still here. They're still fighting. They're still the same old dad, still loving them, just maybe in a different rhythm than before. They need permission to feel confused. They need to ask those questions, those hard ones, and to trust that the adults in their life are going to be able to hold those questions, answer them with care, and feel good about it. So I want the community to know that I will be expanding on this conversation. It's a very important one, as you can see. You know, it was hard for me to not show so much emotion as I was discussing it, but I really want to continue to share strategies for not only talking to young children, but also how to approach these conversations with adult children. Many of you have grown children that they're still your children, however, they may be adults. You still have to have these hard conversations. So we are going to be talking about that more. And whether you're a parent, a grandparent, an aunt, or an uncle, these conversations matter. So please make sure that you're having them with these little ones, like my little guys there. So thank you again to Damon, Donna, Jess, and Dr. Masami for their honesty, their vulnerability, and their very, very powerful messages. And thank you to all of you for joining us, or if you're watching this later on, thank you so much for tuning in. I really hope that this webinar gives you more confidence, or at least just makes you feel a little less isolated in your journey, because you're not alone. We're here. And I invite you to continue this conversation, whether it's on social media when we post up the video or in our online community. Please, let's open up this conversation. Let's help one another have these difficult conversations, approach people with knowledge. So you can always visit our website to explore more tools, resources, get more understanding regarding this disease. And from all of us at the IgG4-RD Foundation, thank you. Have a wonderful day.